We're talking about acne today, and we know that about 80% of people from 8 to 30-year-olds will get acne. Now, this has a big impact on people's self-esteem and the way they manage themselves as they're growing up and even in adulthood. So we're shortly going to listen to our colleague Chloe, who is our advanced skin and laser therapist, talk about her journey, her skin story in managing acne, and how she had to go one step further from being managed by our nurse-led clinic at Qutis into seeking a dermatology referral for Roaccutane. So the closest thing that we have in the world right now to a cure for acne, for moderate to severe acne, is a drug called Roaccutane, also known as isotretinoin, and in America it's called Roaccutane. Roaccutane works by blocking the sebum production in the pore. So quite simply put, the drug says stop to the sebaceous gland, and all of the sebaceous glands will be reduced to barely any sebum production. Now, this means that the drug is quite toxic. So blood levels have to be done before anyone is considered for the Roaccutane program. A psychological test and interview will be done to ensure that the prospective patient is able to go on a 3 or 6 month course of a very strong drug, such as Roaccutane, that will cause not only their face sebaceous fluids to dry up, but the whole of their body. So therefore, the liver is tested at 6 weekly intervals to ensure that the drug isn't working at toxic levels within the patient. And then the drug is titrated, and what that means is the perfect dose is found, or the lowest dose is found, to enable the drug to work and there not be too bad side effects. However, with isotretinoin, it is known that people can get depressed whilst on it. People have very fragile skins whilst on it, nosebleeds, cracked lips, dry scalps. People can even get muscle aches, and they can even get joint pain. And they certainly are asked not to drink alcohol, so they have to give things up, and not to they have to be on the oral contraceptive pill if they're a female of childbearing age, because the drug is so strong it can affect fetal development. So patients who go on to Roaccutane will visit the dermatology service about every 6 weeks, have these blood tests, and will be their dosage will be studied and increased or decreased, and they can expect to be on the drug for about 3 to 6 months. Now, our NHS is busy, isn't it? So we like to think, as a private nurse-led service, that we can offer support to our patients who have gone on to Roaccutane within the NHS or within a private dermatology referral. So what we do is exactly use our products sensitively. We're careful about which products are put on. We use LED light. And you're going to learn a little bit more from one of our patients, who's also our colleague, on her journey through acne treatments within a nurse-led clinic to Roaccutane within the dermatology service, and how we can help her both now and beyond.
So my name's Chloe. I work at Qutis in clinic. I'm a skin and laser therapist, and a lot of you will know that I was a patient before I worked at Qutis, and today I'm going to talk about my history with acne and how Qutis, so Maria and the nurses, have helped me. So I've had acne for about sort of 8 to 9 years. I started getting acne around sort of my jawline area. and I started trying sort of home remedies, so bananas, sort of rubbing on my skin, coffee scrubs, and then going to like your supermarkets, trying sort of different brands. Nothing really worked. I found that it made it a lot more worse. And then speaking to my mum and sort of getting quite upset with my skin, it wasn't sort of healing, that my mum decided to take me to the GP. Then we went to my GP, spoke regarding about my skin. They prescribed me different types of antibiotics, different creams, but I found nothing really worked for me. And it was when me and Mum were walking in Tame that we saw, at the time it was called MBNS, obviously it's now Qutis, that we thought we would go down the more clinical route, because they are nurses, it's a nurse-led clinic, that we found it was probably the best journey for me to begin healing my acne, and that's where I met the amazing team of Qutis. So before going to Qutis, we sort of tried different skin pills. I did go up to London to have a skin pill, and it just made my skin worse. I didn't see any sort of improvement of my skin. And then when I had my consultation with Qutis, I sat down, they spoke all about my skin, they took photos of my skin, so that we could really in-depth talk about what was going to be the best route and what skincare was going to suit my skin needs. So at the time I was put on is clinical range, so it was the cleanser, the Pro Heal active serum, and then most importantly an SPF as well. And then I went away, used those products, and then because my acne was still present and I was in retail at the time, I became so fascinated with how the skin works, all about beauty, the skincare industry, that I decided to leave the fashion industry. And I had my heart set on, I wanted to work at Qutis, wanted to be in this amazing industry that helps people with skin. So I went back to college, and then as soon as I finished my course, I said to my mum, I want to work at Qutis, this is the only place I want to work at. And I had my heart set to work there. And then I had a meeting with Maria. Yeah, now I've been with Qutis for 3 years and it's been the best decision that I've ever made. But they've also helped my skin journey. They've really made me understand about skin, about acne, not just about your skin, but your health inside, your gut. So using probiotics, eating well, you know, keeping active. And then I've been able to continue with my journey with Qutis by having different treatments, so my hydrofacials, IPL for my skin. We've tailor-made it all to me, which has been great, because a lot of places they just say, here's this product, use it. With Qutis, we tailor-make it for each individual. And that's what I love about Qutis, that they've been able to tailor make it for me. And also you do have the nurses help, which I think has been really helpful for me. So yeah, I was still struggling with my skin, even though having regular hydrofacials and treatment were helping, my acne never got 100% better or cleared. We weren't able to sort of break that cycle. And Maria messaged me and she said, maybe let's have a rethink of Roaccutane. And I thought that actually it's probably the best time. You know, I want to start a family, you know, weddings. And I think as well, getting to sort of, now I'm 27, I'm thinking, well, I shouldn't still be having acne. And I'm so glad that Maria did come to me, because I kind of put Roaccutane on the back burner. I thought, you know, all this negative side effects, I thought, well, I don't want to go on it, especially if I suffered with anxiety. But actually, when you read into it and get the knowledge from Maria and the nurses, you realise that actually it's such a small case, and a lot of the time, you know, there's no need to be worried. So I'm glad that Maria did decide to sort of reach out to me and say, look, let's have a rethink. And she's been able to coach me on how we can go to my dermatologist to get that referral. So I was advised to take pictures of my skin, which helped because then it showed my acne over sort of 6 months of my waiting time, of how my skin, you know, got a little bit better, then got worse. It showed that journey that my skin's never been clear. And I think having Maria give me key points to tell my dermatologist, this is what we've done for my skin, this is what we think could be causing it, helped the case for me to get onto Accutane, because it is quite a difficult journey to sort of push into. So I think years of having acne and constantly going back to my GP, I think that helped as well, because I think you do need to have a history of having acne, because first of all you'll try antibiotics, you'll try creams, so they want to make sure that they've tried everything possible, because it is such a strong drug. It's not an easy decision. They want to make sure that you have tried everything possible. So then after trying everything through the help of Qutis and the nurses, we decided, right, we'll go back to my GP. And again, I took pictures of my skin so that I could show my GP. I went in and said, you know, I'm still suffering with my skin, showed them all my pictures, and obviously because they have history of me having acne for such a long time, I was able to be put on a waiting list. Now the waiting list is quite a long time, so you do have to prepare for that. It's not going to be a quick, you know, you're at the dermatologist, you can go straight away. So for those 6 months, you know, it is that waiting game of getting sort of there. So I went to the dermatologist and then had my sort of consultation, and they were like, yep, you're successful for treatment. But obviously in the meantime, while waiting, we made sure that I was still continuing with my hydrofacials, my laser treatments, and also the amazing brand is Clinical. So I use the honey cleanser morning and night, followed by the shield, my SPF, and obviously my lip balm, which is really important. And then being on Accutane, I've also continued the skincare, which has really helped. So when I had my appointment with the dermatologist, they kind of said that you would experience sort of dry lips, you could potentially have nosebleeds, you would get kind of dry skin, but obviously they are busy, so they kind of don't focus so much on skincare. So that's when I then spoke to Maria, and Maria said what the benefits are going to be from our brand. So I used the shield, which helps with sort of my dry skin, because I did find that I was quite sort of tight, dry, itchy skin. I do have a little bit of dry lips, so we use the which is the new is Clinical Lip Protect, and also because your skin is sensitive when you're on Accutane to light, so SPF is really important. So it's great that the lip balm also has an SPF 30. You know, we should be looking after our skin and also our lips. So I found that's really helped keep my skin sort of hydrated while I've been on Accutane. So when going on Accutane, I didn't really know what sort of treatments that I could have. So then I spoke with our nurses at Qutis on what treatment could be done because you can't have sort of laser treatments while being on Roaccutane because the skin is so delicate. So we sat down, had a talk through what could be done for my skin, and that's when we tailor-made a medical facial for me. So that's a gentle cleanse, so we use the honey cleanser, and then we would follow by the LED mask. So I use this sort of every day on the blue setting, which helps with inflammation, calming the skin. So that's been a lifesaver for me, especially when I have had a couple of breakouts, you know, on my lunch break for a good like 15 minutes. I've put the LED mask on, and just even that 15 minutes has helped my skin. Like, I know Rhiannon, who works on our reception, has said before, oh, your skin looks so much better. And I have noticed having the LED mask has allowed my skin not to flare out too much. So I've not had really bad breakouts, and I think that's been because I have had the LED mask, but also there is clinical range. So I think my experience with Roaccutane has been a lot better than I thought it would be. I was quite scared that my skin was going to be one giant spot. I was, you know, scared. But actually, when I sat down with Maria and our nurses, I found that actually I can have treatment and keep my skin looking sort of healthy as well. Yeah, no, I am excited to finish and be able to continue with my skincare, especially having my hydrofacials. I have definitely missed them. So I think it's so important, even though once I have finished Roaccutane, to continue with your skincare. I think that's what happens sometimes. We have really good skin after and we think, oh, we don't need anything, but actually you do. You need to continue with your good skincare routine for life. It's like when we go to the gym, you know, we have a membership, and it should be the same with our skin. So yeah, I'm excited to continue having treatment. And I think as well, to have treatment for my acne scarring, so like collagen pin, Erbium Yag, just to kind of refine the texture of my skin. Excited to be able to sort of go out without makeup and just feel happy within myself, and just be able to sort of wake up and not touch my skin and think, oh, have I got a spot this morning? So that's what I'm most excited for, and just continuing my skin journey as well with the help of Qutis, Maria, the nurses, and just enjoying life. Yeah, no, I definitely think if I had a video like this all those years ago, I think I would have felt a lot more confident to start Roaccutane, as I think I went about 6 years ago to the dermatologist, but I felt scared to go on to the drug. I think there's so much negative information out there about the drug, but actually having a video where it talks about Roaccutane, what's the benefits, you know, some of the side effects, but I think having this video, you know, will help so many more people with acne and make that decision to go on Roaccutane. But also Qutis, we are here for you, and I think that's the lovely thing. You know, we are like a big family, that we will help you on that skin journey. You know, just because you have gone to a dermatologist doesn't mean that our help stops. So yeah.